So we're just clarifying that every surgeon here for this podcast has a slightly unusual name pronunciation, because I thought it was just me. Like forever, it's meant to be Poon, not Foon. But like I don't even bother with the silent H thing because it's just so annoying. I just embarrassingly slurred Ania's surname under my breath because sometimes I worry
Most people don't even attempt it. They just go smooth.
Yeah. Well, tell us how you say it then.
Smialkowski.
Sorry?
Smialkowski.
I'm going to have to practice that one.
Yeah.
Pratik?
Rastogi.
Rastogi. Not Rastogi?
No, not Rastogi either.
and Sarah, who you'd think would be the easiest one, because I thought for ages I was saying like Lonie.
Lonie.
No. Now I'm going to be self-conscious about it. so I guess
I'll answer to Lonie or Lonie.
Yeah. So, but ultimately, like we're all surgeons at Sydney Body Contouring, and we're doing this podcast for you guys so we can talk about like stuff. Remember, it's not meant to be like medical advice, but it is just us talking about issues that I think people want to hear a bit more information about. So, if you want that specific advice, you have to see a surgeon or a doctor to give you that specific advice, right? So. There's the disclaimer out the way. Also, try to subscribe. We'll try and put out as much content as I'm not going to say smash the subscribe button, but I'm tempted to. But I think that is a perfect opportunity for Ania to tell us about a conference.
Yes, I had the great privilege of going to Miami this year to one of the biggest conferences in body contouring, which is called Total Definer, run by Alfredo Hoyos and the Total Definer Group. And it was a great opportunity to do, firstly, a cadaver workshop, practicing some of the techniques that they were talking about, and then also 2 days of really intense content and discussions about the latest technologies and advances in body contouring that are really popular.
Was it face and body contouring, or just
mostly body contouring with a small face section as well? Yeah. But probably the big headline sort of sessions of the couple of days were advanced higher definition liposuction, which involves intramuscular fat grafting.
Do you want to just give us a bit of like overview of just liposuction types, just before we just go the super specific?
So liposuction's come a long way in the last few decades. It's no longer just removing fat and debulking. And apart from just sucking fat out, which is basically liposuction, removing fat, there's more sculpting involved now, which is, we're not artists, but it's removing fat to enhance the contours and the underlying anatomy. And so a number of technologies have been developed to aid the safety and also the precision of those techniques. And so there's a few different things that we use. One of the big changes was something called VASER liposuction, which is an ultrasound-assisted liposuction. Now, VASER doesn't actually remove the fat. VASER is a device that heats up the fat through ultrasound waves, and it bursts the fat cells and makes them liquid. Yep. So it liquefies, and it heats up the tissue, and then after that, you go in and suck the fat out with a liposuction cannula. But it reduces the blood loss in the tissue that you're removing. It contracts the tissue by only about 6 to 8%, theoretically, so it's not a huge amount of contraction.
I just pull you up on that tiny bit, like the tightening related to the thermal side of things. So I think all of us, and maybe we'll also talk about some of the other techniques too, right? Like the devices, I suppose, but like that common pathway does seem to be heat.
Yes.
And then heat leading to...
Controlled thermal injury, basically.
100% leading to denaturation. So if you think of, you've got frying an egg in the pan, the protein goes into the pan, hits the pan, goes white. And when it does that, it shrinks up. Right? So the same sort of thing happens. So Pratik, how do you sort of see where, how do you stop, where does it go from being therapeutic and helpful, tightening that skin, to being like dangerous? And do you think there's it's easy to burn someone, or do you, where do you sort of see yourself on that sort of situation with heat and damage and
I think you've got to be careful.
Yeah.
So like in my opinion, some people get amazing results with just VASER liposuction and intrinsic or extrinsic skin tightening devices in the operating theatre and outside. most of the patients I see tend to be patients in whom the skin excess is more than that can which be treated by just a liposuction device. So they really need liposuction, maybe a little bit of skin tightening, but they need a skin removal part. And those three elements, liposuction, bit of skin tightening, possibly, and skin removal, gives them the best result. You've got to be careful with VASER. Because
at 2 points, right? Because like both where the tip is, but also
the whole cannula.
The whole cannulas. But yeah, they have these so like they got these like little plugs, don't they, to stop at this burning of the skin.
Yeah, so it's like keeping the skin protected where we're going in through the skin, and then cooling the skin down as we're doing the VASER to make sure it doesn't burn. But it is useful that it definitely gets a lot more fat out rather than just doing the parassisted liposuction, but used with caution.
Yeah, there's definitely, and that was in Miami, there's a lot of talk about complications and management. Yes, some big sessions on that. And yeah, there have been some disasters around the world from using the devices improperly.
I've certainly, at some conferences, you just hear people throwing, like they almost think, well, if one skin tightening device is good, I'll use everyone and it's going to be like 3 times as good, right? Like, and I just sort of think to myself, oh my God, that's like a complication waiting to happen. You know, whether you use an RF one or a VASER or like whatever, like all of those modalities can potentially burn you.
Absolutely.
Yeah, and skin and cooking the network of the blood vessels that sits just under the skin, which keeps it alive.
Yeah.
You know, like it's super bad. Pratik, when you were in the States, when you see like those liposuction clinics, I always like the most amazing liposuction results I feel like I personally see from people who have really thick skin. Like, you know, some people with African American skin or just like really thick skin of their back. Like some of those results, I sometimes look at it and go, man, that's just like incredible, that result. But that's not the same. You can't translate that to every single person. So I think that is really a real challenge there. So
I'd second that. So in the US, there's so many ambulatory care facilities that do liposuction. They walk in, walk out, but the best results were from men and women who had a muscular build and good skin quality, predating it, and then both African American men and women, their results were really quite amazing. Because they just had that natural skin shrinkage. It's like they can just mask any sort of subtle imperfections.
And I think they maintain the thickness of the dermis for much longer. And
what's the dermis?
The dermis is one of the layers of the skin. It's the thick layer that holds the elastin, the collagen, the hyaluronic acid. It's the integrity of the skin. So if you feel like your eyelid skin or the back of your hand, it's super thin, so the dermis is thin, but like your back and your shoulder has really thick skin. So the thicker it is, the better it sort of contracts. It's got more stuff in there to heat up and to contract. And I feel like, especially in the Australian population, we are exposed to so much sun and UV radiation damage from a much younger age, and it's a cumulative effect that in our 30s and 40s, our skin is like a 60 to 70-year-old.
Takes a hit.
You know, Latino or African American sort of population, because our skin just thins out really quickly.
Absolutely. And like a tiny little plug here. So we here at the clinic do all sorts of the surgery. So I think some of those lipo clinics where if you come through the door, you're getting lipo. Don't come to the lipo clinic if you don't want lipo, right? So, but one shoe doesn't fit all. If all you've got is the hat, like I keep on going all day long with the hammer nail analogies, but like I think really just trying to pick and choose who's a good candidate, who's not. What do you do for Sarah to try and pick who gets what procedure?
Yes.
And are you happy to have hard conversations with patients sometimes?
So everything has to be tailored individually to the patient. I think we were speaking about before, like when we have to say no. So like if you're not at your ideal weight yet, or sort of there's some things that need to be optimized. Like we want to operate, but we don't want to operate and give you a bad result. So that can be the first sort of hard line on when to operate or not. Then like the options there, it's sort of liposuction or other techniques and excising skin. So it's really a good discussion to have about what's going to get the best result, and if you need skin removed, having an abdominoplasty is going to do a lot more than just having liposuction. So coming and discussing that is going to be the best option.
Could we come back to what you were saying when you were at your conference in Miami and you were talking about like fat grafting into muscle, and tell us a little bit about like BBLs, where they're doing it maybe for like abdominal muscles, and can they make that like a safer procedure, or is it still like always going to be unsafe?
Yeah, there's many sessions on fat grafting. So obviously Miami was very, very well known for all the controversies associated with BBLs.
Brazilian butt lift.
Brazilian butt lift, which is where you put fat injected into the gluteal or the buttock area to enhance it. So there was a lot of controversy because a number of people died having that procedure. They died by something called usually fat embolism, which is where the fat accidentally gets injected into a blood vessel and then causes a stroke. And so it actually became illegal for a while to do BBLs in Miami, and now they have done a lot of research and investigation into it. There's a big sort of overview of it, and in Miami you're not allowed to do buttock fat grafting without using an ultrasound. So that's one of the techniques that has increased the safety of the procedure, and they've also banned injecting directly into the muscle for that muscle group. So one of the beautiful things that Alfredo Hoyos and Matt Stefanelli, this group, did was they've actually sort of classified all the muscles in the body in a classification system, which plastic surgeons love classification. And so they've kind of made this very easy to follow safety guidelines based on like green muscles, you can go for it, red muscles are a no-go. So it's kind of like the Matheson, the high classification, but for fat grafting.
With the traffic light.
With a traffic light system.
It's a really simple way. Yeah, good.
There are a number of muscles that are safe and a number of muscles that are not safe to fat graft into. And I think when you look
why would they even do that? Like, I mean, who wants to get there? Like,
no, but
pronated teres
people
are getting their vastus medialis and their vastus lateralis, or injected, and people have died having vastus medialis injection because it's gone up the Hunter's Canal and will cause a fat embolism. Like this is what's happening overseas.
They're not my patients.
Name a muscle, someone has tried to put fat in it. I tell you.
Yeah.
That was the thing that shocked me most when I was there. Like primary for men, pec. Fat grafting.
But it's so effective. This is the thing, when you see
it,
you're like,
push-ups are really effective.
A few more chest presses and squats.
But one of the interesting things is like it's not just about, the fat doesn't just provide bulk, it provides stem cells then for muscle hypertrophy when you activate the muscles as well.
Like the results are
the results are phenomenal.
Really?
I'm telling you, so when you look at your obviously our Instagram is very different to what's allowed overseas. You look at the results on all these people's pages and you think, how come we can't get
but
that
how
here?
do you... Okay.
I'll tell you one thing as being cynical. Before I went there...
I was going to do that, but you can do it.
I used to see high definition liposuction as this, window shade, 4 horizontal lines underneath the skin, and they would say this is liposculpture. And then you go there and you see it. It's in the right hands.
It's beautiful.
Yeah.
Yeah.
You don't look like Lego Batman after.
Some people do, and this is why some people do, even if they're following the techniques, which is why doing the courses, doing the cadaver labs, going to the workshops, doing all the conferences, all that stuff is so important, because it's not like, I've gone and done the course and the conference. I'm just going to start injecting fat willy-nilly into people's, there's a lot of finesse to it, a lot of skill that's associated with getting it right and choosing the right patient, and that a lot can still go wrong when you do it. So.
I think it's also like you just don't watch a YouTube video or a plastic surgery tutorial and then say, I'm going to try it on Monday on your patient. It takes a lot of time and care and whatnot, right?
And picking the right patient for it too, right?
Yeah.
The regulations around, so the AHPRA, which is the regulatory board that we operate under here in Australia, they have really rigid guidelines about the sort of stuff that you can show and you can't show, and things that you can say and things you can't say. And for the most part, initially I was like really kind of against it because I just felt like, but now I kind of think, well, maybe there's definitely some good parts to it where you're not just showing selfie photos of people that have been airbrushed and all that sort of stuff.
Yeah, exactly.
So I think that's good.
One thing it made me feel better about myself in general, because I was like, the Brazilians are like quite full on and spectacular.
Great surgeons too, by the way.
Great surgeons. And they were showing all these photos of like Victoria's Secret supermodels before and after, pretty much. And I was like, I don't feel so bad about myself. Like they're going from like they're taking women who are a 9 out of 10 or a 9.5 out of 10 and making them an 11 out of 10. With these techniques. You would never know that they've had anything done. But I was like, okay, don't believe everything you see out there, people. It's like a little bit of fat goes a long, long way.
Yeah, that's true. But like sometimes, like trying to get someone from a 98% to a 99%, you are rolling the dice, right?
Absolutely.
And I actually had a very like a lady who was very high up in the Miss Universe rankings, and I did a rhinoplasty on her. She looked pretty good already, and it was
high stakes.
It was high stakes. It was
Yeah.
quite stressful. So it is always sort of risky when you do those sorts of ones as well. So what areas, you go to a conference like this, see a lot of interesting stuff. What was one spot, or what are 3 things that you think I'm bringing back here to do?
The combination of using the technology,
Yeah.
so the VASER, the whatever skin tightening with lipo, but also with excisional procedures. So
In combination.
And I think the power of something like a pectoralis fat grafting in men with gynecomastia and things like that, I think is very valuable.
Yeah, right.
And then just assessing people, body contouring patients, and sort of, looking at not just like isolated areas, but if you're going to address the pecs, and think of the tummy and the arms and everything. That sort of like really treating the whole area, the whole look, rather than just one spot.
Well, that's the classic example with those post-pregnancy combination procedures, right? So the common conception is that we're just trying to bundle things up for people and get them to have more procedures. But, if you're looking at the midsection, for example, and you tighten someone's muscle and give them a flat tummy, there's no point leaving the back really puffy, because then it kind of looks weird that you've got a flat bit at the front.
Yeah.
And then nothing at the back. And then like sometimes that fat that you might have at the back can then be utilised in like the hollow bit at the side of the buttock thing, or maybe you help reinflate the breast. And like when you combine all those things, it does sound like a lot, a breast and an abdominal procedure. If everything is sort of like rejuvenated at the same time, it sort of looks
better.
It looks better. It kind of looks like in sync a bit more.
So someone comes and says, I just want tummy lipo, I want you to like flatten everything. But then if you've got massive love handles or like flat rolls on your back, the picture doesn't match. You want to match the whole area. It's not that we're trying to upsell you, it's thinking about the overall aesthetics.
And look, if there are a whole lot of reasons why people might want to do this procedure separately as well, right? Like no hassle, but I think for the most part, patients will have you've got to have a recovery, and if you're going to be thinking about doing that second thing as well, that means 2 recoveries, and then so doing 2 things at the same time, within reason, often means using one recovery to recover from 2 things, and it's not twice as bad. So the exception for me, I guess, would be the bigger body contouring things. So like there's definitely an hour limit that I like to try and keep to. How about you, Sarah? How much is too much for surgical procedures when you bundle them together? Have you got just a general rule of thumb? Or?
Yeah, I think it needs to be limited in time, and Ania and I often operate together, so it sort of makes it more efficient for the patient. But about 6 hours starts to become a bit too much. Sort of ideally maybe about 4 hours, but sort of doing it abdomen and breast at the same time, and then coming back at a second stage for sort of arms and thighs.
Because you've got to walk around, you've got to get yourself out of bed. So people won't, a lot of complications are going to go with all these surgeries, but for me the big one for the bigger body contouring surgeries where you can actually die from it. It's not like bleeding to death, it's getting a DVT.
Exactly.
So DVT is a deep venous thrombosis. You get a clot in your legs because you just can't get yourself out of bed. And if that then dislodges and gets stuck in your lung, you're dead. It's a big deal. So we give you blood thinners, compression stockings, all that sort of stuff just to minimise that.
And limiting the amount that you're doing.
100%. So you can't sort of be like both arms, both thighs, tummy and breast, and you're like in hospital like this.
Yeah.
I think that's...
A caveat unfortunately, I've seen patients who have had that done overseas in packages. A good time to bring that up, where they've pushed the limits, and
That's going to be a bigger problem. I think we're all seeing that much more.
Where are you seeing them go to?
Well,
Turkey, Lebanon,
Turkey,
Lebanon, Thailand.
Lebanon, I've heard recently as well.
Yeah.
Thailand's always been a very classic spot for people who have breast augmentation. People going to Korea for their eyelids and stuff to have those done. And like, what are the risks involved with that?
So, like, huge risks in terms of travel and in terms of the operations they're having. So in terms of travel, like if they're only there for a short amount of time, they're sitting on a plane, then afterwards the risk of like a DVT again, and then going over there, they don't have the same regulatory bodies that we have here, so you don't know what kind of facility
Well, what if you saw them
have
on
your operation
Instagram and
in.
got heaps of likes?
Yeah, heaps of likes, heaps of reviews, like all these things that you can easily buy.
It's amazing before and afters. You're like, is that even the same person?
Yeah.
Have you seen some of those before afters?
Some of the
where it's
Turkish
like
before and
literally-
afters
it's
look
literally
like
the
that.
daughter,
Yeah.
and you're like, nah, that's
I
like...
know, I have friends send them to me all the time. They're like, is this real? I'm like, if it seems too good to be true, it kind of
Yeah.
is.
But
Yes.
some of the Turkish ones almost look like before and after is a different
Person.
Oh.
person.
It is a shame because there are like excellent surgeons in
Absolutely.
Turkey. and excellent
Academically,
surgeons
they
of all
publish
over the-
so much.
Yeah.
They're so good.
Yeah, but
Um,
just as Australians going there, they don't necessarily know if they'll be treated in good facilities. We don't know whether like sterility is considered the same.
Different
and
bacteria that we don't have
Yeah.
here.
We see all sorts of complications come back because of two big operations that they don't stay for long enough. If they're there for 5 days, whereas we would keep seeing a patient for weeks and months down the track.
Can
They
I
don't
play
have-
devil's advocate on one particular procedure? I do think they do a good job with hair transplants, though.
Oh, amazing.
Like, I mean,
Have you seen, do you know the DJ Fisher?
Yes.
yeah.
Oh my God.
Yeah.
Like, he
Has he
was
got a
like
full head of
full,
hair
like shaved skinhead, and now he's got the most amazing,
Amazing hair, yeah.
hair. Like,
where does it come from?
Turkey, I'm pretty sure.
No,
Has to be.
but
But he looks
It's like-
amazing. Like, he looks so good. It's
Is he?
an unbelievable transformation.
kids. I mean, that's you guys aren't doing.
You don't need to
hair
worry about it.
No, no, good. My problem is that it's just all like white and grey now, so it's getting teased from my kids. But it's quite a laborious process, the hair transplantation, because they usually, well, my understanding of it, and correct me if I'm wrong, they take a segment from some place, and then there's like a whole like back room where you've got like almost like little people like
No, I
trim
think
them
Little
up.
Oompa
they
Loompas.
have
Oompa Loompas.
I think they have machines now that
They have robots that-
rather
Oh, really?
than-
But
rather
the-
than-
AI's come.
But if you
Yeah.
They're
actually,
going to replace us.
most of the
One day.
Turkish places don't use a robot though.
No,
So it's all follicle harvesting, and then they individually
put them in.
put them in.
It's
So-
like rice paddies in Southeast Asia. Isn't it? Like they kind of like
I've
get
done it once for a cleft lip scar. That was enough.
Have you?
Yeah.
Wow, but like when they plant
That
the
was
rice,
sufficient amount.
don't they get like they have like a seedling, and then the person goes around and they make a little hole. So
Yeah.
with the follicular unit, then they've got to put it
Yeah.
in.
It's like
And they're doing 10,000.
dividing the follicles.
What?
10,000 follicles.
8 to 10,000 follicles
On one
per
person?
session. Correct. It
It's
takes
like
8 hours.
to 12 hours,
Yeah.
yeah, and the local sedation.
I don't think I hate performing procedures in the local because I can't maintain small talk for that long without getting really
Sedation.
awkward and getting really hot and bothered. That's a long time. That's a really long time, but it just seemed very good. Did you ever see Silvio Berlusconi's hair? He looked like it was like fully. Do they do it so it like doesn't look so obvious now? Like
Oh,
it's-
yeah, it looks pretty amazing.
Where do you get that number? Can you give me the number?
Asking for a friend.
Asking for a friend, exactly. No, hopefully you won't need to worry about that one. Yeah, okay. And finally, like the fat grafting to the muscle, which pec major, yep.
Yeah, I think
So
it's a high
you'd
yield
suck
one.
out you'd suck out fat for a gynecomastia, and then put some fat in.
Yeah.
Same fat, of course.
Yeah,
Yeah. Ultrasound guidance.
ultrasound guided, yeah.
So you need an ultrasound machine too.
Yeah.
Handheld or like a big
You
fancy
can-
one.
The anaesthetic ultrasound is always around, so that's
Yeah.
a really good one. They're usually really high quality, but yeah, you can use the little portable handheld. You
Yeah,
seem to be
wow.
able to get an image. Obviously, knowing your anatomy, understanding all the layers and where the blood vessels are that supply the muscle.
Yeah.
But it really, I think, makes a really nice difference to overall contour rather than just having a flat, skinny chest.
You know, one thing I also wanted to ask you about after the conference is so the two conventional skin tightening devices out there that most people use in this country are VASER and Renuvion. I for a while I was using the Renuvion one because I just felt that I get less of the surface burns.
Yeah.
It was quite good. Tell us about the Ignite one, because that's one that I haven't used or
it's
seen before.
probably one of the newer ones on the market, and it's, I guess, just like an evolution of the devices. So it uses radio frequency energy, so again, heat, but it's very short pulses of heat, so it's very controlled. It doesn't spread very far. It goes about a centimetre, and it doesn't use gas.
Yeah, so it doesn't blow it up.
It doesn't blow it up and spread through the
That's
tissue.
such a pain.
And it's a lot.
Emphysema.
Yeah, exactly, and it's a lot faster. So, yeah, it's just an evolution of a similar technology as Renuvion, I guess.
Yeah, so those of you that don't know, there's often at least 2 stages, but sometimes 3 if you're doing a breakup with a VASER. Like you'll
Melt the fat.
melt the fat sometimes,
Then remove it.
and then you've got to
in.
like treat it again. So it actually takes
a
a
while.
fair bit of effort to sort of get to that point. How do they, for the skin contouring post liposuction? I've seen some like crazy garments that people have that like pushing ab contours or whatever. Is that a thing? Is that going to be something?
It
you
is a
start using
thing.
more? The sticky tape, like there's
Yeah,
one that
there's
look like
tape. There's like
a
the
third
sports
year
tape.
sports tape everywhere. Like,
Yeah,
it was
and
like
part of that is
2 hours
for
to do that.
contouring. Part of that's for lymphatic drainage, and that's, I think, one thing that we don't do very well here compared to how accessible it is overseas. It's a lot cheaper. So all of the things that help get you the better results, like if you broke your wrist, you do your physio after you fix your fracture.
True.
Lymphatic massage and all those garments, that's part like your physio for these kind of procedures. And it's not just for liposuction, it's for abdominoplasties, all those kind of procedures. But
Yeah.
they're a thing.
Yeah, okay. All right, well, that was a heck of a wrap-up for a conference in Miami. They actually have one in Cartagena, Colombia,
Yes.
but that's a bit too soon, and I don't think I can go to that one.
Mm.
But I think I'd definitely go to one of those South American conferences just to sort of see.
They do funky things, right?
Yeah.
They just think
Push the
differently.
boundaries.
Yeah.
Yeah, so
It's really nice to just have your mind opened to different ideas.
As they say, if you want the pearls, you've got to dive for them, right? Like,
Yeah.
like there's going to be some pearls in there. There's going to be some furious self-promotion with very little data behind it. And then just trying to be able to wade through all of that, like the bullshit from the actual stuff that make a meaningful impact in your practice is the skill. Which conference would you go to if you're going to go to one? There's ISAPS in Mexico later.
Yeah,
on this
exactly.
year.
ISAPS in Mexico looks good.
Kind of
And there's another group called the South American Plastic Surgery that do a similar sort of
Yeah.
thing.
All right, watch this space. All right, I think that's the wrap up for this week. Like at the end, we always sort of say just what we sort of talked about it before. Just remember, it's not medical advice. Just us talking about stuff. If you want stuff specific to you, then by all means, just always send. Got to see a surgeon about it, or contact us. Very happy to talk with you about it. And what don't I miss anything?
Subscribe.
Subscribe button, and ask us any questions if there's something you want us to cover. We'll do our best to do that. All right, see you.